We welcome you to the Rural FASD speaker series, where we are thrilled to present to you today in a very exciting presentation from Ontario Health, the new quality standard that they have just released, known as the Transitions from Youth to Adult Healthcare Services Quality Standard. It is the guiding evidence-based care, and it's designed for young people ages 15 to 24 years in Ontario. And we first of all want to begin with our land acknowledgement, where we thank the Algonquin people for the usage of their traditional and unceded territory on which we currently are work, play, and pray. And so let's get into the introductions. As you are probably aware, my name is Robert Moore. You've likely seen me serve as the host of a lot of these presentations, but have never really had the opportunity to hear me speak on a particular topic. I am here today because I had the pleasure of serving as the lived experience advisor with the Quality Standards Advisory Committee. I am joined here as well by Carol Kennedy, who is the lead of Quality Standards Ontario Health, as well as Dana Summers-Laughlin-Bose, who is the senior specialist of quality improvement, quality standards team in Ontario Health. However, within our conversations as to who was going to be doing the presentation today, because our audience is primarily yourselves as caregivers, Ontario Health felt that it was probably most appropriate for someone who would be considered a peer to be able to do this presentation today. And so when I look at the experience that I've had working with Ontario Health as to how they very much treat lived experience as equal partnerships, as recognizing that the information that we have to share is just as valuable and just as important, and keeping us involved in the process all the way through really speaks to how dedicated and how important it is to Ontario Health that lived experience is treated at that same level and recognized in the same way as any other service provider or work experience. And so today, in terms of our outline, we're going to be looking at a lived experience story here shortly, as well as data that exists on transitioning from youth to adult healthcare services. We're going to look at an overview of an overview of the transitions from youth to adult healthcare service quality standard, the standard itself, as well as additional resources. And finally, we will have a question and answer period at the end for our live studio audience. And so first of all, I wanted to begin with just sharing why it was important from the Rural FASD standpoint and myself personally to be part of this advisory committee. In terms of our two oldest daughters, we have certainly seen the transition that went from youth care to adult care as being one very much a learning experience, one that was very much lots of gaps in terms of how that was done. And we realized that there must be a better way of creating that transition. And so it was through the standard that I had the opportunity to kind of hear that I'm not the only one that was going through this experience, that we were seeing this experience on a fairly regular basis across the province. And through that, we have already began to see the difference that it's made in my daughter's lives. Everything from being able to now access support services, that really we would have liked to have seen at the age of 18, but we're accessing now. We're able to access healthcare services at this point that we're missing up until recently. And so the standard definitely brings that out. In terms of another young person with lived experience, they described themselves as being a curious child, which was evident every time I was diagnosed with a chronic illness. My curiosity quickly turned into confusion, though. and my various providers didn't ensure that I understood the foundation of my own care. I felt out of control and uncertain. My transition from pediatric to adult services helped me spark my curiosity again by diving into learning as much as possible about my health. In finding my voice, I became my biggest advocate, which was the crucial skill for crossing into the adult world. I learned how to speak up when something wasn't sitting right. In advocating for myself, I avoided delays in my care, didn't need visits to the emergency room, and even noticed a decrease in my anxiety. I felt more independent, which gave me hope for a successful future away from home at university. This quality standard encourages healthcare providers to always include young people in their transition plans, and it supports young people to ask questions, share information, and advocate for their own health. And we also have very much seen a very similar story in that the key is being able for the young person to advocate for themselves. They are definitely the ones who understand best what services they need and the supports that they need in order to be able to succeed in life. And so why do transitions from youth to adult healthcare services matter? Well, first of all, the data says that care transitions where the transfer from youth to adult-oriented healthcare services is a vulnerable time for young people and their parents and caregivers. It is during this period that young people are learning to manage their own health. They're also changing healthcare providers and adapting to new services, people, and processes, while also transitioning to adulthood, a time of physical, psychological, and social change. And we certainly know within our group here with Rural FASD Support Network that those multiple transitions are absolutely huge. And in fact, if we were to even rank where the transition among healthcare services versus the transition of that physical aspect, that psychological aspect, and that social aspect, I think healthcare services would actually come fairly low compared to being able to do some of those psychological and social changes. And so being able to not have to worry about this type of transition is very much a key aspect. We also know that 15 to 18% of young people in North America have a chronic health condition, and that almost all of them, 98%, are expected to reach adulthood, which means that they're going to be looking at a transition to adult healthcare services. We also know that almost 20% of young people will have at least one challenge with mental health or substance usage before they are 18 years of age, and up to 70% of them are going to require care beyond that age. However, the data also shows that when transitioning to adult services, about 60% of those individuals are unable to currently access treatment. And this leads to service gaps and absolutely pose additional health challenges. I would also add that we know from research that young people with FASD, it is actually 90% of them are going to have mental health or substance use challenges, based on the research done from Dr. Popova. And when you think about that, 60% of those individuals then are unable to access treatment, you can imagine why this is such an important quality standard for the rural FASD. We also know that young people with complex medical conditions, developmental disabilities, and/or intellectual disabilities are particularly vulnerable during these transitions. For example, young people with complex physical disabilities and their parents and caregivers experience a lack of access to health services and information, and that in turn leads to uncertainty about the transition process. And we've certainly seen over particularly the last couple of years that uncertainty almost always leads to anxiety. Anxiety then leads to negative outcomes. And when you have that, coupled that with the lack of access to healthcare services and information, We certainly know that the vulnerabilities that are associated with that are certainly high. We also know that care coordination and information sharing and support are important aspects of the transition. Without these components, young people may experience negative outcomes such as loss to follow-up in adult care, low satisfaction, and this in turn can lead to increased emergency department visits or hospitalizations. And once we get into the quality standard, you will see that care coordination part is so key in being able to successfully navigate this transition. That it is that aspect of, we are certainly been blessed with our FASD workers here at Ontario, but one of the key challenges that we face is the fact that they are only allowed to work with our children up to the age of 18. And so they are unable to serve in that role for that transition period that we're talking about here as recommended by the quality standard. Finally, some groups of young people may also face even additional barriers in accessing the appropriate care when transitioning to adult healthcare services. Some of those examples include those living in the rural, remote, and northern communities who face geographical barriers compared to their urban peers, which impedes their access to care. And again, we are absolutely thrilled that Ontario Health has included this extremely important aspect in here, that those who live in the rural and remote areas and the northern communities, geographical barriers, in fact, can be the greatest barrier of all. And we have advocated strongly for the importance of having access to transportation within these areas so that that obstacle can be overcome. We also know that those in care in the child welfare system who research has shown experience higher rates of homelessness, unemployment, poverty, and lower levels of education compared to peers who were not in care. Indigenous, Black, and racialized youth are also at greater risk of facing challenges. These systematic inequities can lead to negative outcomes during the transition. And one of the pieces of information that you may not be aware of our current membership within the rural FASD group is about 85% of our children originally came through the child welfare system in one aspect or another. And so once again, we thank Ontario Health for bringing attention to this particular facet of challenges. So let's get into it. What is the quality standard? First of all, the quality standard, just in terms of a little bit of background, the quality standard was just released here in February of 2022. The scope is care for young people ages 15 to 24 years of age, and it's for all clinical populations, including young people with disabilities, special healthcare needs, chronic and or complex physical, intellectual, and developmental conditions, and or with mental illness and substance usage. And when I was preparing for this presentation and I came to that second aspect of the scope, it occurred to me that FASD basically encompasses that entire second section of disabilities, special healthcare needs, chronic and complex physical, intellectual, and developmental conditions, and mental illness and substance usage. So what is a quality standard? Well, a quality standard is a set of documents that's developed by Ontario Health that tells, number one, clinicians and patients what high quality care looks like. Two, it focuses on the conditions or processes where there are large variations in how that care is delivered, or where there are gaps between the care provided in Ontario as well as the care that patients should receive. And finally, it is grounded on the best available evidence. Quality standards also help patients, residents, families, and caregivers know what to ask for in their care. Two, it helps healthcare professionals know what care to offer based on evidence and expert consensus. And again, that has certainly been our experience, that the healthcare professionals that we work with absolutely want to provide the best possible care, as long as they understand what that care needs to look like. Third, it helps healthcare organizations measure, assess, and improve the quality of care that they provide. And again, that aspect of measure, as we learned last month in our speaker series, is so key, because without the ability to measure, you can't communicate exactly how you're doing and where you need to go. Finally, helping ensure consistent and high quality care across the province. Some of the resources that Ontario Health offers, and the two main ones that I want to bring to your attention, obviously the quality standard is there, but they have also at this point now developed their guides for both the young people as well as for caregivers, and as well as a getting started guide and a measurement guide. At the end of the presentation, we will show you exactly where you can locate those guides for the young people and caregivers, because I know you're definitely going to want to read those over following this presentation. The guide for the patient guide is designed to give the patient information on what the quality care looks like for various conditions based on the best evidence, so that they can ask informed questions of their healthcare provider. Finally, how is the quality standard developed? Well, it starts with the clinical guidelines that are established within Ontario Health, and they basically establish that initial framework of where this is, of how it's going to be developed. From there, they then reach out to community partners and establish their advisory committee. And this is where Ontario Health reached out to the Rural FASD Support Network, and I got involved with them. And let me tell you, I was absolutely amazed to see exactly who was involved within this committee. Everything from executive directors of some of the largest medical organizations that you will find in Ontario, including the Royal Hospital, including some of the large hospitals out of Toronto, as well as some of the smaller clinicians located in some of the rural and remote areas, as well as people with lived experience who did a wonderful job of advocating for themselves and sharing their own experiences. And all of that information was treated as equal partners through the entire process. We also, the quality standard then also looks at all the data analytics that are connected and that can be accessed as it pertains to this particular standard. And then finally, it is then sent out to all the stakeholders and received consultation on. And with that consultation, I again saw multiple changes to the standard based on that stakeholder consultation, and it was absolutely extensive as well. The last thing, though, that I wanted to make sure that everyone understood is it was absolutely an equal collaboration all the way through. And it was very much designed to ensure that the best quality care could be created for everyone with Ontario. And so let's look at the statements, the 6 statements. The topics that we're looking at, number 1, is early identification and transition readiness. 2 is information sharing and support. 3 is transition planning. 4 is coordinated transition. 5 was introduction to adult services, and the last one is transfer completion. So quality statement number 1 reads as follows. Young people who will transition out of child and youth-oriented services are identified as early as possible and have regular collaborative reviews of transition readiness to support their ongoing preparation needs for transition and the needs of their parents and or caregivers. And the key aspect that I want to bring out on this particular statement is, as we have seen in so many other aspects of research, early identification and early and really getting started on this as soon as possible is the absolute key to be able to successfully do this type of transition. We have seen when there's early diagnosis of FASD, we have seen when there is early support for individuals with disabilities, that's when the greatest life outcomes are achieved. And this quality standard is recognizing the exact same thing needs to happen from a transition standpoint within healthcare as well. The second aspect of it is the regular collaborative reviews. And really what this is doing is it's enabling the child to practice advocating for themselves. We know that if a child is asked at the age of 18 to advocate for themselves for the first time in their life, it's not going to go particularly well. Whereas if they have been advocating and learning how to advocate for themselves for years on end and have had the opportunity to do so, that they are in much better shape to then advocate for themselves for the rest of their lives moving forward. Some of the resources that I want to bring to your attention, the first two in particular, the Youth Toolkit as well as the Family Toolkit from BC Child's Hospital, as well as the Well on Your Way from Alberta Health Services. Again, we are very aware that BC and Alberta have really led the charge on all of this for multiple years, and it's reflected as well within their resources that they developed. These have been in place for between 15 and 20 years now. They've really got it down well. And so these are wonderful resources that if you're looking for that checklist in particular of the kinds of things that you want to be referring to, this is a really good place to start. We do have a good one here in Ontario that was developed by Sick Kids, Transition to Adult Care Learning Hub. But obviously, because it hasn't been around nearly as long as the BC and Alberta ones, but it does certainly bring that Ontario perspective. And the key aspect that I want to bring out is it was also designed by young people for young people, reflecting their particular language. The second one that we want to bring your attention to is the My Transition app, which has just been recently released by McMaster University. And I'm seeing within our group that we're actually recognized and very familiar with this one because several of our members actually served on the pilot project and its development, as well as the field testing that following. And we can personally vouch for the fact that this is an extremely good resource for sure. The second quality statement relates to information sharing and support, and it reads, young people and their parents and caregivers where appropriate are offered developmentally appropriate information and support to meet their needs throughout the transition process. Information sharing is collaborative, and healthcare providers actively seek the experience and expertise of the young person and their parents and caregivers where appropriate, and incorporate it into the transition planning and shared goal setting. And again, one of the key aspects that I'd like to bring out here is that actively seeking the experience from the healthcare provider. And so we also look at, from that responsibility standpoint, who is initiating these conversations, who is initiating this transition. And there is an expectation that the healthcare provider is going to be the one that is going to play a role in that, where they're going to actively seek the information from the client or the patient in this particular case. The third statement relates to the transition plan. Young people will have an individualized transition plan that is co-created, documented, and shared within their circle of care. When we look at the transition plan itself, we are certainly very familiar within the educational system where they have what they call their individualized education plans, and the quality standard is very much envisioning a very similar type of document where it is that collaborative aspect where all parties that are involved are coming together in a co-collaborative and co-creative method. It is to some extent, could be considered a living contract where it is continuing to be documented, it's continuing to be updated, and most importantly, it is shared within their entire circle of care. The key to any successful transition is we know it is the network. It has to be done within a network. It can't be left to just one or two individuals. Again, in terms of examples, some of those resources that we've seen, there's been lots of studies and lots of research around this particular one, and you can refer to those following this presentation as well. The fourth quality statement deals with coordinated transition. Young people have a designated most responsible provider for the transition process. This provider works with the young person and their parents and caregivers where appropriate to coordinate their care and provide support throughout the transition process and until the young person and their parents and caregivers where appropriate confirms that the process is complete. And again, two of the really key aspects, and I'm reminded of when we were having these discussions and developing this particular statement, this was really, really important in terms of the actual language that was used here. The first one is the designated most responsible provider. And the understanding here is there's a recognition that depending on who your healthcare providers are, depending on which circle that you're associated with, that provider could be a social worker, it could be a developmental service worker, it could be an FASD worker, it could be someone from your community, it could be whoever the individual, the young person is most comfortable with in terms of being able to serve as that system navigator on their behalf. That is really who that designated most responsible provider is envisioned to be. The second aspect, though, is who gets to make the ultimate decision at the end as to when that transition is complete. And it is and the standard states that it needs to be the young person that makes that final decision, that it is not necessarily a healthcare provider or organization that's going to make that decision on their behalf. The fifth statement, introduction to adult services. Young people, with their parents and caregivers where appropriate, have a meeting with key adult services or other providers before the transfer to facilitate and maintain continuity of care. And again, when we think about from an educational model standpoint, we always, within those transitions, you will see a transition, for example, from an elementary school to a high school. Well, those transition meetings always include meeting your high school staff, meeting your high school contact people before you actually get to high school. And so the idea is the same here, in that your healthcare providers are going to do all those introductions, all those questions are going to be asked. The plan is all in place. You know who your contact people are before the transition actually happens. And then finally, the last statement is the transfer completion. Young people remain connected to the designated most responsible provider for their transition and are supported until healthcare service transitions are completed and confirmed by the young person and their parents and caregivers where appropriate. And so again, that designated most responsible provider serves in that system navigator role until the transfer has been deemed complete by the young person themselves, is really the key aspect of this. So in terms of next steps, Ontario Health so next steps really includes both dissemination as well as implementation. As we know, quality standards is an absolute wonderful document here. It really reflects, we believe, exactly what the quality care needs to look like and how it can be accomplished. But as we know, you can have a great idea, but if you don't necessarily get it in place, it doesn't go any further. And so how do we get it in place? Well, we get it in place by two steps. Number one is through dissemination. So Ontario Health is currently working to raise awareness about the transitions from youth to adult healthcare services, the quality standard across Ontario. They're doing this through webinars, they're doing this through newsletters, they're doing this through social media. In fact, I know that they have a webinar coming up on April 27th where they go into much more detail about the quality standard and answering any questions on their site. I believe they make mention to that webinar. I also know that particularly coming in the summer and fall months, there's going to be a lot of emphasis on that dissemination aspect and bringing that awareness piece forward. However, from an implementation standpoint, this is where Ontario Health is really asking for your help. Implementation, very simply, is for us to go to our medical professionals and letting them know that this quality standard exists and asking them to please look at it. You're going to simply ask them to go to Ontario Health's website. You're going to direct them to the standard document, and we're going to simply do our implementation from that standpoint. We know within our own grassroots organization here that all 500 of us, when we sit down and think about how many medical professionals we are all connected with, considering just from my own personal standpoint, we're currently connected with 14 different medical personnel. And as you can imagine, through just our implementation, working with those that we know, we will literally reach thousands and thousands of medical professionals across Ontario. And that's really how this implementation can be accomplished. And so in terms of those final resources, how do you find the quality standard? You're going to go to www.hqontario.ca. There, you're going to find evidence to improve care. You're going to click on the quality standards. You're then going to click on view all quality standards. And finally, you're going to click on the transitions from youth to adult healthcare services in order to access the standard and the accompanying resources, including those guides that we were referring to. As you can, and if you make it to this page, you know that you are at the right location. And so at this point, I will simply leave you with that information. We thank you once again for joining us here today on the Rural FASD Speaker Series. Next month, we will be back and we are going to be welcoming Karen Moore from the Adoption Council of Ontario, where she will be doing a presentation on developmental trauma, which we will also be looking forward to with great anticipation. So once again, thank you for joining us. Be safe, and we'll see you next month.